Hello, my name is Tip McIntosh, and I work as an administrative specialist in the Oregon Health Authority's Hospital Staffing Program, also known as the OHA. The OHA's Hospital Staffing Complaint System is how Oregon's hospital staffing law, including the updates to 2023's House Bill 2697, are enforced in Oregon. In this video, we will provide a quick overview of service staffing under the hospital staffing laws. The statutory definition of service staff is service workers as defined by a collective bargaining agreement, or, if no collective bargaining agreement exists, by the Chief Executive Officer of the hospital or the Chief Executive Officer's designee, consistent with the National Labor Relations Board regulations. The National Labor Relations Act and related regulations do not define service staff. Examples of service staff can be members of environmental service workers, facility and maintenance workers, and nutritional services and other positions defined by the collective bargaining agreement. The classification of these positions varies between hospitals, depending on collective bargaining agreement, or if no collective bargaining agreement exists, then the hospital's executive officer has the authority to determine who is in this category. This means that a dietary service employee may be included as a service staff at one hospital, but not included at another hospital. The requirement for service staffing committees is in the Oregon Revised Statutes 441.776. The statute details the committee and plan requirements. The statute requires that each committee must consist of an equal number of service staff members and service staff managers. The operational requirements for service staffing committee member selection reflects that if there is a union representing the service staff at the hospital, then the union or unions selects the service staff committee members. If there is no union, then the service staff managers select the service staff members of the committee. Committee meetings must have a quorum. A quorum is 50% of the members plus one. For example, a service staff committee with 12 members would need 7 members present to meet the quorum requirement. The individuals present can be any combination of service staff manager committee members and service staff committee members. The statute also has an equal voting requirement, which means that regardless of the number of service staff manager committee members and service staff committee members present at the meeting, only an equal number of manager and non-manager committee members can participate in any vote. For instance, in a committee of 12, a quorum is 7. If there is one service staff manager present and 6 service staff members present, the committee has the necessary quorum to meet. At that meeting, only one service staff member and one service staff manager would be allowed to vote because of the equal voting requirement. The service staffing committee must meet at least 3 times a year. Only service staff members and service staff managers can be on the service staffing committee. Under the Oregon Revised Statute 441.777, the service staffing committee can be combined with the nurse staffing and professional technical staffing committees. In this situation, they will conduct joint meetings, yet each will retain its own co-chairs and voting systems. The service staffing plans cannot be combined with the nurse staffing plans or professional technical staffing plans. Each staff type requires its own plan that must be approved by the committee responsible for that type of staff. When developing the service staffing plans, the committee needs to consider hospital census, the location of patients, patient types and acuity, national standards if any, the size of the hospital and square footage, ensuring patient access to care, and feedback received during committee meetings from staff. The OHA can only enforce service staffing plans that reflect required staffing. The language used in the plan to reflect the staffing is crucial. The OHA can enforce staffing levels that are described as required, mandatory, maximum ratios, minimum numbers, and staffing level terms, must or shall. Staffing levels described as recommended, ideal, core, target, allowed staffing, or those that suggest may or are labeled as guidelines are not enforceable. The OHA can only enforce the staffing law requirements that are listed in ORS 441.792. The specific violations related to service staff that the OHA is authorized to investigate are failure to establish a service staffing committee, failure to create or adopt a staffing plan, failure to comply with the staffing level in a service staffing plan and the failure is not a permitted deviation, failure to release service staff members that are part of the staffing committee to attend a staffing committee meeting. The service staffing law includes multiple requirements that the OHA is not authorized to enforce. Starting June 1, 2025, the OHA will be able to impose civil penalties for violations of ORS 441.792. The OHA is actively investigating complaints received before this date, but the civil monetary penalties are not possible for non-compliance that occurs before June 1, 2025. For more information, visit us at www.healthoregon.org/hospital staffing for OHA's FAQs, webinars, and other resources. Thank you.